Okay, work of breathing, and remember, we didn't talk about grunting respirations, did we?
No.
Sometimes when infants have trouble breathing, they'll make a grunting noise, like that. They generally don't cough after doing that. But it usually is indicative of a difficulty breathing type of issue. And circulation to the skin, just what it sounds like. What is seesaw breathing?
Back and forth between the chest cavity and the abdomen.
Absolutely, it's abdomen, chest, abdomen. Very, very common in children that are in respiratory distress. Okay, differences in children versus adults. Obviously, airway and head are some of the bigger differences. And given the problems with the airway, we know that airway control in children tends to be challenging. Breathing issues tend to be very common. As for bone structure, their bones have not fully developed. Musculature or adipose tissue or fat, that leads to certain types of injuries. We talked about the fact that bones don't tend to break in children, they tend to bend. The fact that children can have internal injury and be totally asymptomatic. And as we go down here, I think we also talked about vital signs being much more rapid in children. Why is it more rapid in children?
More energy.
Yeah, they need more energy, higher metabolic rate. I don't know how many times we've gone through the difference of respiratory distress and respiratory failure, but if you don't know the difference between it now, I think you're going to have some difficulty. Major concept between the difference. And what is the difference between respiratory distress and respiratory failure?
Compensation?
In respiratory distress, the patient is having trouble breathing, but the rate and/or depth of respirations are adequate to keep them alive. In respiratory failure, the patient is breathing, but the rate and/or depth is not adequate to keep them alive. So in distress, we use a non-rebreather. In failure, we use a BVM. And it's absolutely essential that you know that. What does drooling mean?
Airway compromise?
It can, yeah.
Epiglottis?
In epiglottitis, we would say it. Do children normally drool?
Yes.
Yeah, little kids normally do drool. They don't have any teeth. So I'm not sure that drooling by itself in an isolated situation means much of anything. Respiratory rates, I think, are fairly self-explanatory. We all caught up?
1 second. I'm so right now.
I'm sorry?
Give me 1 second.
He said, give me 1 second.
Give him 1 second. Okay.
Alright, I'm done. C1.
Know your BLS for children, and that includes airway obstruction, CPR, to a small extent, basic life support.
How do you do chest thrust on an inpatient again?
How do you do chest compressions?
No, chest thrust.
You just push on their chest.
Jeff, can you go back for a second?
Can you go back one second?
Okay.
So you do 5 back blows and then 5 chest thrusts?
As long as they're conscious,
Okay, you
Well,
continue, how long do you repeat that?
until they become unconscious, or you alleviate the obstruction.
So continue, there's no like wait period, no breath, no rescue breaths, nothing.
No, you need to remove the obstruction. Okay, dealing with a childbirth. Alexander, are you almost done?
I'm done.
Okay. Infant and child CPR. You can actually look this up in your book. There's nothing here that is not someplace else.
What was the breath rate for a newborn baby?
3 to 1.
No, I'm sorry, their normal breathing rate for
40 to 60.
40 to 60.
That's their normal breathing
Yeah.
pattern per minute. That's not what we deliver to them.
No, that's what they normally breathe.
40 to 60.
Yeah.
And their heart rate, you know?
Heart rate is generally between 140 to 160. Somebody look that up, the respiratory rate in the newborn.
That's correct.
Pardon?
That's correct.
It is, okay. Difference in shock. And again, this should not be something that's new. Shock is no different in children than adults with one exception. They don't have a decompensatory period, or if they do, it's very, very short. You guys looking forward to Christmas?
No.
Oh.
Are you?
Kinda,
Yeah.
yeah.
Your grandkid, is your grandson coming?
No, I'm not, he's not, but I sent him a tricycle.
Oh.
He doesn't like traveling apparently. He gets very fussy, according to my daughter.
How old is he?
You should know that, right? 18 months, I think,
Okay.
about 18 months. He's still
He's young.
pretty young, yeah. I mean, he can walk and he kind of babbles for talk. But he knows, if you ask him something like smile, he'll smile, or show me your belly, he'll point to his belly. He does know that, and I think he's got some idea of shapes.
Okay.
Because he'll take blocks that have certain shapes and then put them in, it's like a container with holes that are the same shape as the shapes that he pull out. Does that make sense?
Yeah.
Yeah, he loves doing that, putting the shapes back in. We played shapes, what was all last Sunday.
Gotcha.
Okay, meningitis. And in meningitis, what we're looking for really, the big thing with meningitis is nuchorigidity or stiff neck, photophobia, audiophobia, headache, fever. Sometimes patients may have sore throats or upper respiratory infections.
So it'd be surgical mask and gloves.
I'm sorry?
Surgical mask and gloves for like BSI?
BSI, yeah, full BSI.
Full BSI?
Yeah, yeah. Particularly if it's bacterial. If you know it's bacterial, I mean, that is a very high risk individual. You don't want that. And that is, I don't know that you actually get a rash on your legs for meningitis. I think you get it just on your chest.
I thought that's how, like, in the lower extremities, I thought that's like how you differed it from,
Bacterial.
yeah, like,
Bacterial, viral.
no, like,
Some of the
Oh, what
homeless
is it when
population
you-
has it all over.
what is it
Pardon?
when you,
Some of the homeless population has it all over. Even if they've been treated for it, that stuff isn't going away.
Petechia?
No, the homeless population, I've seen them have it. Like,
On
it's
their
like-
whole body?
I've seen them all, like parts that are exposed. I don't know about the whole body, but like their arms and their back.
Can't imagine it was meningitis.
It looks like that though.
Purpura, I mean, those rashes occur in a number of things. If they were walking around with that rash and it was meningitis, you wouldn't be walking around.
Even if they've been treated?
Yeah, that goes away.
Okay.
Does the rash occur quick?
Pardon?
Does the rash like occur quick, or is it kind of?
It occurs very quickly, pelvic inflammatory disease. This occurs in women. It's normally sexually transmitted. Lower quadrant pain, vaginal discharge, many times fever. The nausea and vomiting, you could kind of extrapolate. Everything causes nausea and vomiting. And what is the long-term complication of pelvic inflammatory disease?
Having trouble conceiving?
Correct, and if you do conceive, ectopic pregnancy due to scarring.
You said atopic?
Atopic. Pregnancy that occurs someplace outside the uterus. In this case, it would be the fallopian tubes. The egg gets caught in the tubes because the tubes are scarred from the disease. And, I'm sorry?
From the pelvic inflammation.
From the pelvic inflammatory disease, yes.
And that's fatal for the fetus.
Yeah.
Yeah, the fetus, yeah, I mean, it's not, it'll never even become a fetus. It stays an embryo.
Okay, there's no way of correcting that? Or seeing,
You know, I don't think so.
Jeff, no.
I don't think so.
Check no.
Pardon?
It's no. It's a no. On the ectopic, no. But yeah, we had one. With that.
Placenta previa, placenta abrupto, and what is the one way that you can tell the difference? Placenta abrupto, you have pain. Placenta previa, do you have any pain? But your biggest concern is what? In both of them?
Oh, bleeding.
Bleeding, blood loss, hemorrhagic shock.
And one can be, corrects itself, and the other one doesn't.
Yeah, placenta previa may, in rare instances, correct itself. And placenta previa, you don't normally terminate the pregnancy. Placenta abrupta, the pregnancy is terminated because the placenta has been pulled from the uterus.
Wall.
Yeah. guys get your Christmas shopping done? No?
No way, not this time.
All I can say is thank God for Amazon.
Jeff, when is your surgery exactly?
When is my surgery? January 18th. I think it's the 18th.
And how long you be in the hospital?
I'll be in ICU for 2 to 3 days, and then med surge for another 2 to 3 days.
And then back working?
No, it takes about 6 weeks to recover. So I'm looking forward to a long
Yeah, long bedtime.
rest. Well, you know what? I get fatigued very quickly and very dizzy. There were a number of times lecturing, I got really dizzy. That's why I brought the chair up here. Looking forward to that not happening to me. Nuchal cord, what do you do?
Try and
Try to
get over the
You
baby's head.
feel it, you feel it first and then.
You try to lift it above the head. If that doesn't work, cut and
And
clamp.
cut.
Oh, you still would clamp it,
Yeah.
like the normal way? Okay.
Yeah.
Yeah.
There's no way of measuring either.
Tear cord.
Yeah, I mean, you cut it, right? Otherwise, the baby's gonna die. It's gonna strangle. When you see all of these complications, you wonder how the human race made it for so long.
Natural selection.
Okay, meconium staining. The really big issue here is suction. And remember, what causes meconium staining?
Stress.
Fetal distress. I assume you must get a lot of infants that have had meconium in children's.
I have no idea, I said no time to think.
Oh, you don't?
No. We'll get them afterward if they're like any sort of liver, kidney, or GI.
But NICU is totally separate.
Yeah, they're on a different floor. And we don't do LD at all. So
No, I know you don't do that.
usually by that time, they've already been cleaned up.
What happens if you have a pregnant minor? You still couldn't, there's no labor and delivery?
We put her in an ambulance and then drive her across the parking lot
To
either
Hollywood Press?
or Kaiser.
Okay. Yeah, I guess there's no such thing as well, there are pediatric.
Oh, no, there is, and it was a very interesting situation because I had to care for them, and of course, at that point, she's the parent, even though she can technically also be the patient.
Yeah.
And I overheard her, her speaking to her grandmother, can you believe they want me to wake up every 3 hours to feed her? Yeah, that was my face too. Like, what did you think this was, what did you think was gonna happen? Like, this is not a Cabbage Patch Kid.
Well, that's the problem with children having children. They're still children. Signs of abuse. And, you know, we can go over all sorts of issues. Anything that makes you suspicious. How prevalent is child abuse? In every year, we estimate that 1 in 10 children in the United States will have been abused. 1 in 10. That is a horrible number when we talk about child abuse, but apparently it's rather prevalent, and unfortunately, society in the past, like domestic abuse, have tried to hide it, you know? Okay, let's talk a little bit about what this means. Menarche. What is menarche?
Menarche what is menarche?
Is it the cousin of malarkey?
Menarche is basically when a woman's period begins to stop due to age.
Oh,
Sorry,
okay. So that's
menopause.
Oh, yeah.
I thought that was menopause.
That's like one of the best things.
Well, menarche is specifically to
happened
the
a woman,
period.
right?
Menopause, you know, I'm not even sure the difference of menarche and menopause.
I could find out for you.
Yeah, that'd be kind of interesting.
Well, it's-
You can tell my gynecologist.
Men that are going through menopause.
They might know. A little more.
I didn't hear anything.
Primipara, first live birth, gravidium or gravida, number of pregnancies, prima gravida, first pregnancy, gestation, the duration of the pregnancy.
So menopause is the first flow of the woman's menstrual cycle, so that's when it's going through puberty. And then,
That's menarche.
oh, menarche, yeah, sorry. And then menopause is stoppage of the
Oh,
menstrual.
menarche is when they start.
Yes, and then
Yeah.
meno is when they stop.
Okay. I honestly
Pause,
thought
stop.
menarche was when they stop. Okay.
Pause.
Tells you what I know.
You start and then menopause is stop.
Okay.
Can you go over the last three again?
Gravida, gravidarum, pregnancies. Prima gravida, first pregnancy. Gestation, duration of pregnancy.
Wait, so primipara was first live pregnancy?
Yeah, first live birth,
And then this prima gravida is.
first pregnancy.
Oh, okay.
So, would you think that these were invented years ago? I mean, this is in Latin, right? Do you think these words were made up back then in the Latin days?
Yeah.
They were?
Yeah.
Wow. So they've traveled this long
Yeah.
as the same word. Now, that's why most of the words were invented.
That's why Latin is so important because it's an ageless language, is it not?
Primipara.
You say no, primipara was first live birth.
The duration of the pregnancy.
Of the pregnancy.
Correct.
So minority is the first
Gestation.
You could say gestation also with like bacterial growth.
Yes.
Yeah, you could say gestation and bacterial growth. All right, you've got a 34-year-old female who is having mild contractions during the second trimester. They're consistent, they're not increasing in frequency and intensity. Does anybody know what those are called? They're practice contractions. Braxton Hicks. And most women who have given birth can tell the difference between Braxton Hicks and contractions that are involved in childbirth. Do you know how to make Braxton Hicks contractions go away? Hot shower.
Vicks.
Vicks! Yeah, Vicks does wonders for it.
Wait, so Braxton?
So Braxton Hicks contractions are just stronger.
No, they're not strong. They're mild. They occur. They're not. The contractions are basically the uterus getting ready to give birth and to have just basic regular birth contractions. But these are contractions that are mild. They don't increase in frequency or duration, and they occur prior to full term. And they were obviously named after Braxton and Hicks.
The detective show in the 70s?
Braxton and yeah, kind of like Starsky and Hutch, right? Now, who the hell is Starsky and Hutch?
Oh,
If you grew up during the 70s, you know who they
oh yeah. I used to see Huggy Bear. I used to work at a supermarket at Ralph's and I see him every day.
Oh, really?
Oh yeah.
Oh my gosh, yeah, he was one of the characters.
Yeah.
Oh my gosh. Yeah, the guy that played Hutch actually tried to take my girlfriend out. He's an asshole. He is really an asshole. Yeah, the girl I was seeing was a model, and he was doing everything he could do to hit on her, and he's a jerk. The guy that played Starsky, on the other hand, is one of the nicest people you'll meet. He has AIDS,
Okay.
and
cool.
his
So you just
wife
X out.
and his
Good man.
What's his name?
child died of it.
You're like, I was gonna get done in the next two.
Webster.
All right, you are assisting with the delivery of. Okay, you're assisting with a delivery, and the head is starting to crown. What is the next thing that you do?
B.
You don't apply pressure to the head.
A.
B. Oh,
Okay, no pressure. You're guiding the head out, but you're not applying pressure to it.
Allow
I
the
thought-
head
Nuchal cord, as the head, listen to me, as the head delivers, you want to make sure that the cord is not wrapped around the neck.
What do you do in the case that because it does get wrapped around more than twice,
Cut it and clamp it.
or like
Yeah. I mean, you don't have much choice.
even if I thought was it somebody else? I think it was like
no, that's only if it's going when he's coming out feet first and you have the feet.
no, not that one. There's one where it like wraps around multiple times. You can't get like a grasp on it. So like
By
cut
the
it in
time
pieces.
you got, yeah, to be honest with you, if you tried to lift it above and it was multiple times, you're probably not going to have time to do that.
Their head is like pointy. It's not like round. It's like comes out really pointy.
It's called cone head.
Yeah, cone head. Really? Yeah.
All right.
Because
When you will,
you
you guys interested in this?
Yes.
Okay. When, what accommodations do you need to make when putting a child on a backboard? Padding behind the torso. Why? The occipita is large, and you would cause hyperflexation if you don't elevate the torso.
Right?
You get the picture?
Their head is abnormally large.
Well, it's not abnormal. I mean, it's all kids are born that way. It's not abnormal. It's normal for children.
Okay. Wrong word, but their head is larger.
Correct.
Which allows to go back.
Correct. Correct. All right, you are caring for a pregnant lady, and your partner placed her in a left lateral recumbent position. Why do we do that?
B.
Supine hypotensive syndrome, or maternal hypotension. Very good. And she's on a backboard. What do?
You pat it.
Well, you
Turn it
tilt
at 30 degrees.
30-degree angle in order to get the uterus to roll away from the inferior vena cava.
What is it called?
I think you missed the last one.
I know.
That's
on purpose.
Jeff, is that
It's like that's the natural angle.
Okay, if everybody talks at the same time, there's no way I can understand what anybody is saying to me.
Jeff, Trendelin, right? Trendelenburg?
For what?
For the pregnant lady? Left?
Just left lateral.
Left lateral?
Left lateral Trendelenburg if there's bleeding.
Oh.
All right, you are assisting with a childbirth. You've just delivered the infant. You've dried and stimulated. The skin is pale. There's some peripheral cyanosis. Heart rate is 80. What do you want to begin doing?
B.
Pardon?
B.
B.
As in baby boy.
Yeah.
Never. That's exactly what That's
That's
a
joke.
Yeah.
I saw that. Oh, get out! And he just runs away from Anthony.
And he freaked out.
So I
And
can't
he's
do
like, I quit this job. And takes off his like glasses, throws them, takes off the gown, and then runs, books it.
During the
Yes.
OB.
It was during the
Practice
like the
deliveries?
OB like complication deliveries.
What happened?
What?
Our group leader quit in the middle of the pregnancy yesterday.
Well, yeah, he was delivering the child and he's like, I can't do it. Just like.
And said, I quit this job, and took off his gown.
Oh my gosh.
Freaked out. He
You
picked
should have
D.
seen
Scenario
the
was
day
in the
we were
liquor
in
aisle
mixed
at
groups, and
Walmart,
we
so
had
we
to
just went
do
over to where they had the sporting goods section.
paramedic
and
thing, and he was doing
committed
like
suicide
everything
right in the
wrong,
middle of
and
Walmart.
Anthony was the
Oh my
medic,
God.
and he was leading,
Took it a little
and he
far.
kept yelling at him, and he kept getting pissed off and getting yelled at. He's like, I can't do this anymore, I'm done, and he kept just sitting down, and then he'd go help, and then he started doing CPR, and he started singing, and then he's like, who the fuck is that? Get him out! And they were just like, I'm done.
Poor you.
All right, 34-week, female, 34-week gestation, headache, blood pressure 160 and 96, pulse 88, respirations of 18. What is this?
No.
A.
So far, nobody got it.
C.
C.
It is C.
Eclampsia.
It is preeclampsia. What is the difference between preeclampsia and eclampsia?
Seizures.
Seizure. There's no seizure here.
So eclampsia can happen anytime during the pregnancy, correct? Or just like later in like the third
It's
trimester?
usually second and third,
Okay, that's what I'm wondering.
but it
'cause-
can be the first. It can be any.
So it can be any time, but as soon as there's a seizure, it's eclampsia.
But
If it's
what
hyper-
we're looking for is the hypertension.
Yes, so if
before
there's
the
hypertension, it's preeclampsia, and as soon as there's a seizure, it's full-blown eclampsia.
Yeah.
Okay, that's. I just wanted to make sure.
Can you say that one more time?
So anytime during the pregnancy, if she has high blood pressure or hypertensive, that's preeclampsia. But as soon as there's a seizure, that becomes eclampsia. It's not.
Their blood pressure goes down like that?
No, blood pressure
No.
stays the same.
Yeah, her blood pressure is still high, but it.
Pulse.
If it says there's a seizure, it's eclampsia. If there's no seizure, it's just preeclampsia at that point. Or at least that's my understanding.
That's true.
Yeah, so.
Comments or questions? All right, I will be here tomorrow at 6:30.
Thank you.
Thanks, Jeff.
Seminole.